You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. And here on Newsfile, we put Ghana first. Please wash your hands at least for 20 to 30 seconds thoroughly under running water with soap. In the absence of that, make sure you have some sanitizer. And the hand sanitizer at least should be alcohol-based, 70%. At least of alcohol. Don't touch your face. The most difficult commandment to obey. Don't touch your face, but it is important. Now the phone lines have been activated. The phone lines have been activated. Let's have you call. Alhaji Hamza from Nima. Good morning and welcome to Newsfile.
Good morning, Samson.
Yes. What's your question? Yes, what's your contribution?
Yes, what I have is that if the government can take a decision by, because yesterday I was at T3, I saw so many people traveling away, so many people coming in at our airport. If the government can, put measures on that one, either not people to come in, because you can't know who has that disease. And in fact,
there's a travel ban already in place, which has been reinforced.
The way your panelists explained is very,
okay. Thank you, Hamza from Nima. Let's go to Farouk from Tema. Hello, Farouk.
Hello, good morning, Samson.
Yes, you have a question or contribution. What exactly are you doing to stay safe?
Contribution or question.
Okay. Quick.
Yeah, my question is, I've just learned on social media that lemon, cutting lemon, you soak them in the hot water and drink in the morning, helps boost your immune system. I actually want to know if, how true is that? And I actually want to urge Ghanaians, let us take this thing serious, because even the nations with these huge, scientists and with these huge resources, are finding it very difficult fighting this virus.
Okay.
So let's stay united in this hard time, and let's do away with the,
Thank you. Thank you very much. Thank you, Farouk. Obin Sechi, Oda. Obin, let's hear you.
Okay, good morning, Samson.
Yes, go ahead. Let's hear you.
To your panelists as well.
Okay.
And what I want to say is, can't the government implement any law to quarantine those who come into the country? Because it looks as if when you ask someone to do self-quarantine, they feel reluctant to do it. As one of the panelists just said, the man on the sky, Mr. John Amwesi, was saying, his friend's neighbor, let's say relative, came from outside and he asked him to quarantine himself, and he's going about doing his own business. So can government bear the cost now to quarantine them that come to the country?
Okay, thank you very much. Thank you very much, Obing. It is in respect of that the imposition of restrictions bill was passed last night, hopefully to give the president the power to do a few things, even though there are those who disagree that that could be done without this particular process. Richard from Zabila. Richard. Yes, Richard, good morning. Let's hear you.
Good morning. Please, my problem has to do with the it's like only limited to Kumasi and Accra. We have research, and then I think there's another research center to Champo, which are equally very well. Is it that they cannot be resourced equally care of the northern part of the country?
Thank you. Thank you very much. The Ghana Health Service says there will be 2 more in the northern and where? Okay. Yes, Vincent. Vincent Donkokrum. Vincent, what's your question or contribution?
My question is, what is the Ghana Health Service doing for health workers and the nurses and doctors? I can say and commend the general manager of the Presbyterian Hospital in Donkokrum. He is doing wonderfully well, preparing towards any mishap. But what is the Ghana Health Service doing to make nurses and doctors and to say that the whole health workers are secure?
Okay, thank you very much. So we paused here and then we get answers to your questions, 5 of you, and then when we are done, we'll take some more questions. This is what we are doing at this time. So if you want to call, please hold on. Once they are done with answers to your questions, then we will pick your calls again. So, Dr. Bayo, Hamza is asking for a travel ban. That's already in place, right?
Yeah, I think that is in place. If anything at all, we will need an enhanced form internally. Right. That is when we are talking about the lockdown. That is internal
travels.
Yes.
That's particularly, what are you looking at? Air or?
No, not air. Air, yes, in there as well. But when we look at the social distancing, we have to get to a point where in our trotros, we can practice that spacing. Either they are practicing it or we are in a lockdown and no trotros are allowed to move.
Okay.
Because it will serve as a very good environment for transmission. But
there's a problem with air circulation in the small planes that we are using for internal,
Exactly. So that risk is there. I noticed I think Africa World also announced they are cancelling their Abidjan and other routes. I think that pretty soon measures should come out for internal ones, so that for non-essential movement, all that should cease.
Okay.
Yeah.
Thank you. Then Farouk says lemon in hot water to boost the immune system.
Let me just use this to talk to Farouk and everybody else. Eat a healthy, balanced diet to build a very good immune system. All these remedies coming up have not been proven. We've had people come up, and I have people calling me, can I go and buy, what's the best immune booster to buy and all of that. I think all you need is eat well, rest well, very well balanced diet, have a very good sleep.
But it's not bad to have some supplements, vitamin C, for example.
Yeah, no, it's not bad.
Okay.
Vitamin supplements are welcome.
Right.
But a very good diet and a good rest and a good sleep, because your immune system rewinds when you sleep.
Yeah.
So you need a good sleep.
Richard was asking about Kintampo. He says there's a research center there. Yeah. Can't it be improved? But
I think the Ghana Health Service Director General mentioned they are going to enhance it. He said 2 additional centers. The Medical Association has called that it should be regional.
Okay.
So that at least you can have testing across the country. I know there's a Kintampo Research Center, there's a research center at Navrongo. Their capacity may not be able to do these PCRs, but if we decentralize the PCR with mobile technology, they should be able to conduct some of the testing.
And Vincent asked a question which had been answered by the director of the Ghana Health Service already about what they are doing for the health workers. Thank you for that. But before we took the break, I was asking whether if we should have a ban or a shutdown like Mr. Kessie is suggesting, how could it be done? Should we do that in the first place?
Yeah, so I think a lockdown may be necessary, but if we are doing that, I would consider currently almost all our cases have come from the Greater Accra region and the Ashanti region. These are where we've had cases.
There was one in Temaizan or so?
Yes, and it's still within Greater Accra. And so I think that we may want to consider, if we are doing a lockdown, these places which are the hotspots. In fact, we have called for what we call an infograph from the public health people to tell us where the hotspots are. These people who currently are treating themselves at home, where do they live? The people who have come out, where are they? So that even for the clinician, if a case comes to you, you can see closer to where we have cases reported.
So that there will be a partial lockdown, that's what you're saying?
I am thinking
of
a strategic lockdown. And we may begin by things like our transport system, where if you, for instance, say, trotros that move between from region to region, or buses that move in that, if once those are curtailed, there's some form of lockdown.
Okay.
If you lock down the central business districts, then mass movement of people will go down, because it's very difficult to say that people should not move. But there are some things once you do indirectly, there is some form of a lockdown. So if you say the central markets where people congregate should shut down, or they should not admit a certain number of people in a day, that's the form of a partial lockdown.
Elsewhere, where even the cities have turned into ghost cities, you see that some of the lockdown is not complete.
Yes.
You are allowed to go out for essentials.
Things. So that can happen. But for us, so if we had an efficient public transport system, you shut that down and you have achieved some level of lockdown. Without that public transport system, it comes down to our trotros and our taxis. If you impose a certain ban on number of passengers they can carry or where they can go to, and restrict movement in the central business district, immediately we have a partial lockdown.
George, what do you say? There are questions being asked. Yes, he's the clinician, but I'd like to have your view on that as well. Questions being asked about whether if you use clothing, secondhand stuff that we all like to buy a lot, including plates. Should I visit my barber, for example? Women, should they go to the salon? I had to make a decision. I needed to trim up. I have my own, clippers and all of that, but I didn't go to my barber. Yes, so what do you say about those?
So this brings me to my initial statement I made when I came here, that we should not present this pandemic as the same as cholera or Ebola. This is not a hygienic problem. Hygiene helps to prevent the spread. But this virus is not a hygienic problem. So keeping personal hygiene would help. But the only solution, proven solution, is isolation. So you going to your barber, fine, you might keep all the hygienic instances, but what if he coughs on you? So it's not a problem of keeping hygiene is very important. It's very good. It helps slow down the transmission rate. But the real solution is keeping ourselves from intermingling with each other and spreading the disease. And I think that kind of messaging is what should go out, because that's what's needed now. The focus, hygiene is good, but the focus should be on social distance.
Yeah, I'll get Dr. Yes, what do you say about that?
I was just going to say that I support exactly what he's saying, but just to put out that the current data shows us that this virus can stay as an aerosol for 3 hours.
What does that mean, aerosol for 3 hours?
Like as droplets that come out of us when we sneeze and cough, it can be active in that space for about 3 hours. So that means that if you're in an air-conditioned enclosed place where there's no free ventilation, someone coughs and sneezes out and has virus in the droplets, it can last there for 3 hours. On copper, it can stay up to 4 hours. On cardboards, it's been shown that it can stay there for 24 hours. On a stainless steel, it can stay for 48 hours. And on plastics, it can go as much as 72 hours. So it means that on all these surfaces I've mentioned, droplets can land there, they can be contaminated, and they can stay there for a long time. So if you practice the hand hygiene of not touching, and when you touch, wash, then you are not likely to inoculate yourself. But when you enter a place and like your barber, as you mentioned, you may clean your hands, do everything, and as you mentioned, if your barber coughs or another client in there coughs, the person might even be observing the social distance with you. But if the person coughs, this aerosol can stay there for 3 hours. You are breathing in, you have no nose masks on. It means you can inhale them. So the best is for people who know that they have the infection, if they had a nose mask on, that would have kept all of us safe. Because when they cough, their aerosol stays within the mask. But until such that we are able to test and know all those people, the safest is if it is not essential, let's start imposing some sort of self-restriction on ourselves.
So if a woman needs to go to the salon, if they have a face mask, that's good enough so they can go. And as long as they can confirm that they are hairdresser or they are keeping to the practices.
Because we do not know who has and who does not have. If that going to the salon is not essential, suspended. That's what I would say. If you think it is so critical that if you got an infection you don't mind, then your benefit outweigh the risk in this case. Then you can go.
Okay. Yes, and George, again, the concerns have come up about the cost of sanitizers, vitamin C. They are running, and people are increasing the prices. Veronica buckets was about 120 Ghana cedis. Now it's being bought for 450 and so on. What can be done about these things?
So I think this is where we have to suspend the notion of free market, and government has to step in. In fact, this challenge is such that it requires a social response. That means everybody is part of the problem or is part of the solution. No industry is left out. Government meeting with industry leaders should be one of support. For example, those pharmaceutical companies that can provide hand sanitizers, government should give them tax breaks. They should be able to produce hand sanitizers at minimum cost so that they can give it out to the public for free.
Okay.
These are the kind of support systems that government can do to prevent the social cost that was going to
Okay,
come
so
out.
let's go back to the phone lines. I was putting together a number of questions that you have brought in by way of text messages, and they have responded to them as well. And talk about sanitizers. As we know, the FDA is doing quite a good job there. The FDA has tested and approved over 30 more sanitizers within 1 week. It is facilitating the process to ensure availability of sanitizers on the market, which will also help bring down the price. So this is also good. Yes, who do we have on the line? Let's take your question very brief. And if you want to share with us how you are coping whilst your children are not in school, as mothers more particularly, we would like to hear. And if you have a good way of ensuring homeschooling, that should all help others to take a cue. Yes, so we take more of your calls. And once again, talking about homeschooling, the Joy Learning channel is available. Wolo TV, together with Joy Multimedia, are bringing education right at your doorstep in your homes. All you need is a multi-TV digibox, and you can have your children, your wards, enjoy non-truncation of their learning. Yes, Michael. Michael, where are you calling from? Let's have you. Hello, Michael. Okay. Yes, Michael, I can hear you. Michael, you are calling from Kumasi. Let's hear you, quick.
Okay. I just want to find out about the internet. It seems it's very slow, and if things are going to be locked down, how do we communicate very well? Because we have to rely on the internet very more.
Okay. Thank you very much, Michael. George wants to say something about that?
Yes.
Okay.
So I was going to speak on our preparedness towards a lockdown. And as I keep saying, for me...
Okay, so let me finish with the questions. Yes. Frank, yes, Agozume, Frank. Okay, we lost Frank. Frank called from Agozume. You can call back. In the next few minutes, we can pick your call. So Michael was asking about internet.
Yes, it's part of what I think government should be doing now, planning towards supporting industry to help towards a lockdown. One of the key areas will be communication. I think the telcos should be made to bear what is coming and how they can support in terms of helping with communication. I think he also mentioned the area of transport. This is where government should sit down with transport leaders and see what they can also do to help curb transport.
We have an assurance that the transport minister is doing so. John is calling from Laura. John, let's hear you.
Yeah, good morning, my brother.
Morning.
Yes, I also want to ask, use this opportunity to ask one question. You know, Laura is a border town to Burkina Faso. And all the time, we all hear about this coronavirus issues. Right now, it's very risky. What about the security men putting in measure to protect or defend this thing?
Okay.
Because our neighbors from the Burkina Faso, especially, there is a galamsey going on there. And the Ghanaian people are going there to sell every day. And they're also coming here every day.
Okay.
So what are the security men putting in measure to protect this thing? Thank you very much.
Thank you very much. I'm sure that the authorities have heard you. Yes, Kwesi from Dansoman. Kwesi is calling from Dansoman. Kwesi, let's hear you. Okay, I suppose we lost Kwesi on the line. And Dr. Bayu, John, who called from Laura, expressed concern that I think you have raised some of these matters already. Let me pick my very last call from Odum. You are calling from Bojuase. Yes, let's hear you.
Yes, what I want to say is that parents should keep their children at home. Hello?
Yes, go ahead.
Yeah, what I want to say is I'm a teacher, and I would wish that parents would keep their children at home Don't allow them to regather elsewhere at playgrounds. That's another fertile ground for transmission. So parents should please keep your children at home, give them work to do. I'm doing things.
Okay.
So no matter what the work is, give them some work to quarantine them at home. Thank you.
All right. Thank you very much, Mr. Odum. And the latest on the global situation is 284,008 so far. The deaths have also increased. Yes, Dr. Bayo, what do you have to say to the last group of callers and what they have to share?
Yeah, so I think with regards to the gentleman who called from Laura, I think the risk is real. It's not only Laura, we have Hamiley, we have all the border towns. And I think we should be coming up rapidly with a decision now, whether we are locking down our land borders as well, so that if it's a total close, we know that we are doing that. I saw a notice, I think, from the Togolese that suggests that they want to close their borders. I think as a nation, we should look at what we would do, and I hope that the directive will come out in that extent. I support the kids staying at home, and not only the kids. At this point, if you do not have anything essential doing in town, and to such a time that we have either a lockdown declared, you as an individual should assume that everybody else around you might be infected, and therefore stay at home if it's not essential to move out. Only essential workers and things, people who really have to go out, should be thinking of going out. I think that bit, I really support it.
Okay. It's an all hands on deck situation, and as you can see, there are even manufacturers of different other products which are now going into hand sanitizers to assist. I have cited that even Casapreco, for example, is going into hand sanitizers. All of these will help. What do you have to say, George?
Yes, and I really would call for the professional bodies to come together and start supporting government to find a way of curbing the problem from getting bigger. I think this is the time we all need to come together and use our professional expertise. This is a communal problem. Nobody is immune from this. So we should not be making demands at this time. We should be finding solutions. How do we innovate our services to take care of the challenges so that we can bring on board solutions that would help curb the transmission? Because we are all at risk.
Okay.
We are all at risk.
Yeah. Mayor Kofi says drones can also deliver the samples in record time, so we should be thinking about that. Already we are using the drones to do some work. Kobina Edu says, what happens with someone who shows symptoms in Navrongo? Okay, so you call the emergency lines. I'm sure they will direct you to a particular health facility.
And in fact, our health system is so decentralized.
Right.
At Navrongo, whichever district you find yourself, there's a disease control officer, and there'll be a local line you can call. But you can also call 112 and you'll be redirected. Okay. But there'll be a team that would come and help you have your sample taken.
All right.
And it can be transported.
Okay.
One very quick last. So people are walking around from pharmacy to pharmacy, facility to facility with symptoms. I would advise that if you show symptoms, stay at home and call the hotline. You'll be told what to do instead of moving around, and because every time you move around, you are more or less potentially infected.
All right. Anane Frimpong Kwabna says that good discussion. I'm an anesthetist, and I can say for a fact that we don't have ICU ventilators to put over 200 cases on in Ghana. How many ventilators has the Komfanochi Teaching Hospital, for example? As a health worker, that is part of my concern. Togbi Aklopi says that the emergency numbers don't seem to be working. Please don't call them unnecessarily. We understand that they really are working. Eja Adam says that the personal and environmental hygiene protocols are very important. Let's all take note of that. And thank you. We seem to have run out of time at this point. I'm Samson Ladi. And Yenini, thank you very much for your company. Always remember, wash your hands under running water with soap, at least for 30 seconds. You can use hand sanitizers as well. Most importantly, don't touch your face. If you have to sneeze, use tissue. If you don't have one, do so under the corner of your arm. My guests who are here now have been Dr. Titus Bayo with the Ghana Medical Association, and also Mr. George Yeboah Kese with Crown Consults. Thank you all very much. Have a good afternoon.